But I think that we will get there.
Good morning, everybody.
Hi, Roger.
Morning.
Hi, Mickey. How's the internship going? Still enjoying your stay here?
Yes, thanks. Everyone has been very helpful.
Roger, could you please fill me in on what this is about?
Certainly, Jake. Well, hi, everyone. Do take a seat. I suggest that Linda first tell us what problem she observed. I hear you noticed something wrong with the dogs that got the new drug. Is that correct?
Yes, it is. This morning, when I wanted to take the blood and urine samples, I saw that some of the dogs had been vomiting. They looked pretty bad.
You said some of the dogs. Does that mean they're not all affected?
That's right. Some of them had vomited and were still retching, whereas the others appeared to be fit and healthy.
Is the reaction restricted to any particular dosage group?
As far as I can tell, the control and low-dose groups are not affected at all. The animals affected are only in the high-dose group.
So that pretty much means the drug substance is the cause. What did the study in rodents show?
There were none of these reactions, but of course rats can't vomit. There were no clinical findings at all, not even chewing, which is a clinical finding in rats. You can read all the details in the study report.
If you ask me, I think we should consider using mini pigs instead of dogs, since they're not as sensitive.
I'm not sure I agree with you on that. How long have the dogs been treated with the substance?
For 2 days now, and the individual doses were adjusted to the most recently recorded body weight.
It seems to be the concentration of the drug, so we'd better cancel the highest dose if the dogs are too sensitive.
If we did that, would the complete study protocol have to be changed?
Yes, it would. But first we need to figure out which dose we're going to use and then write the amendment. Personally, I would prefer to keep going for another 3 days, without the high-dose group, of course. In the meantime, just carry on with the other groups and I'll let you know what we come up with after talking to the study director. Please inform me immediately if any other animals start showing similar symptoms. Also, could you please send me a copy of your report on the clinical observations as soon as possible?
Sure, no problem. Mickey, would you like to help me with that?
Yes, I've never done that before.